From the top.
As we said, okay. From the top. Welcome to my WOW Chats, words of wisdom with people I admire and respect and whose work is in line with making this world a better place. And that includes you, Casie Danenhauer.
Oh, hi.
Hi, thank you for doing this.
Thank you for having me.
My pleasure. Casie is Doctor of Physical Therapy who specializes in pelvic health, and she's also a yoga professional. And you live in Santa Monica, California, about, what did you say,
It's about an hour and a half from Newport.
So we're in Newport Beach, California for the Symposium on Yoga Therapy and Research. And what I'd like to ask you is this is a big question, but can you give us some ideas as to how yoga helps you as a physical therapist, like in your practice?
Yeah.
You know, like why do you use yoga? What's the value in it? And
specifically with my patients or in my life?
Ooh, okay, both. How about with patients?
I think
focus on that first.
I feel like those two roads actually kind of came together, and they are running parallel and intertwined. A lot of my practice is influenced with what is happening in my personal life as well. And so when I graduated PT school, I also graduated my first yoga teacher training. And so I basically became a yoga teacher and a physical therapist at the same time.
You did yoga teacher training while you were
I did.
going to PT school?
In the last 9 months, yeah.
Wow.
Yeah. So it was a lot, but it was cool now that I have like that landmark of starting both of those things at the same time. And I started off in yoga, I think how a lot of people do, which was in a very like athletic, vinyasa, hot yoga approach that was very power-based. And I had been a gymnast, and so that fit with that model a lot. And for the first few years of physical therapy school, and then being a PT, that model worked for me. I would go to my sweaty yoga classes a few times a week, and it would allow me to kind of get through the week and burn off some stress. And eventually, life, patient care, all sorts of stressors compounded, and I started having body pains. And I guess I'm answering the other part of your question first, which is more of a personal journey rather than with the patients. Yeah. But Vinyasa yoga wasn't doing it for me. It was actually harming my body and making my body worse. And so that was like the first glimpse of, oh, well, maybe when I tell my patients to do a yoga class, because I wasn't really integrating yoga into my physical therapy treatment at that time, I could be potentially doing them harm or not helping them. And so my practice really shifted to be much more yin, much more gentle, a lot more meditation, restorative. And over the years, as I kind of shifted from solely orthopedics into more of a pelvic health-based PT practice, I started seeing patients specifically with chronic pelvic pain who could not move, much less do a down dog or a vinyasa, and were in fact terrified of moving. And so that was a place where I started thinking, okay, I've made a lot of modifications to my own practice, my own yoga practice. How could I give this or share some of this with my patients? Because I saw that I was helping them getting better with kind of the traditional PT approach, but not quite all the way. And I wanted to be able to give them things that could set them up for success, but mostly target their nervous system to allow for healing to take place. And sometimes, most of the time, I would say, that doesn't happen in a hot power vinyasa class with someone's leg up behind their head. So now, I guess to go back to what you asked me first is I use yoga as a way to access people's level of awareness of their state, their own state in their body. And A lot of that is just noticing. A lot of that is breath work. A lot of that is paying attention to sensation, whether it's laying down or in a standing pose. Could vary so much. But I have found that it's been an incredibly powerful tool.
Mm-hmm. Yeah, and that awareness, that's like that first step to change, or that first step to reducing your own suffering. Or like, when we look at yoga and the philosophy, right, of what's it really all about, and it's like having a deeper understanding of our own suffering, right, in our own situation, and gaining more insight. And it starts with awareness. Would you agree?
Absolutely.
Yeah, like that's kind of, so yeah.
One of the powerful things about that, I think, is once you help a patient to slow down, or maybe help yourself to slow down and start to notice sensations within your body, within your brain, you start to notice what feels really good and what is supportive of your system being in a happy state, and what doesn't feel good. And personally, and from what I've seen with my work with my patients, is that as you start to become more and more aware of those things, the bad stuff naturally starts to fade away, because you're actively choosing to incorporate the things in your life that do make you feel good. And that could be a seated meditation practice. It could be choosing to have lunch with a friend. It could be anything that nourishes you. But I think that the tool and the skill of starting to notice what nourishes you is probably the most valuable thing.
I love it.
Yeah.
I love it. So slow down, be aware, and notice what nourishes you.
Yeah.
Words of wisdom,
and hug
Casie
your
Danenhauer.
friends.
Oh, and hug, yes. Thank you.
Thank you.
Thanks for watching this WOW chat with Casie Danenhauer. Casie has some amazing resources, and she offers retreats. So check out her site, casiedpt.com, and check out some of my other WOW chats with other people that I admire and respect.